Welcome to True Health Tuesday, and the truth will set you free. Today we're talking about disease is really adaptation, and I start every lecture with this. Let's get into this. Is disease an intelligent response by the body? Is it an adaptive response? Now, Linus Pauling, quote, just one living cell in the human body is more complex than New York City. and I love this one. The human body is the most complex system ever created. The more we learn about it, the more appreciation we have about what a rich system it is. Bill Gates. So that proves even a blind squirrel can get a nut. Now, please like this video. Please subscribe to our channel. It's going to help us grow, and share this vital life-saving information. Deepak Chopra. The human body is a river of intelligence, energy, information that is constantly renewing itself in every second of its existence. Donald Miller. The human body essentially creates itself every 6 months. Nearly every cell of hair and skin and bone dies, and another is directed to its former place. You are not who you were last November. A constant state of regeneration. And I love this. The body is a miracle of engineering. Every second, millions of biochemical reactions are taking place. And it's a wonder we do not simply explode. And I get this question all the time. But doc, why is the body so stupid? Why do we have so many diseases? Is the body malfunctioning? Do we have a healthy population? Well, let's look at this. In America, and when I'm at my clinics in other countries, I say, look, I'm from the sickest industrialized nation. 1 in 2 men will be diagnosed with cancer, 1 in 3 women. That's 40% overall. 1 in 5 deaths are heart disease. 1 in 3 adults have cardiovascular disease. 1 in 10 have autoimmune diseases. 1 in 5 have depression. 1 in 9 people, Alzheimer's, dementia. 1 in 8 people have thyroid disorders. 1 in 7 have diabetes. 1 in 5 have chronic digestive disorders. Now, so what's the cause? Is it genetics? Is it viruses, bacteria, fungi, chemical imbalances? Do they not have the right medications? Is it random malfunction? So the questions, and these are questions that can change your life in this paradigm. Why is the population so sick? Do we need more medications? Do we need more medical interventions? Do we need more surgeries? Are we not starting people on medications soon enough? Is our species just effective? Now, healthcare today, obviously it's chemical based. You got a symptom, you get a pill, we got an ill. Yeah, they're making up illnesses. The body is broken down in a mechanical system. So you've got the digestive system, nervous system, immune system, respiratory system. And you have different specialists for each of those areas. Now, each system acts separately out of the others, and disease occurs when there's a mechanical problem with one of those symptoms. Again, this is healthcare today, mechanistic, which I'm not in agreement. For healing to occur, the mechanical dysfunction must be corrected using medications or surgery. So what we got, the parable of the blind man looking at the elephant. One says it's a snake, one says it's a wall, one says it's a tree trunk. And the weird thing is, the gastroenterologist isn't talking to the neurologist to see if there's a chronic stress state. The hematologist isn't looking at what stimulates the blood production. Endocrinologist is not looking at why the body's doing it. Max Planck, brilliant, quote, a new scientific truth does not triumph by convincing its opponents and making them see the light, but rather because of its opponents eventually die and new generations grow up that are familiar with it. So the delusion of diagnosis. Is high blood pressure a disease, or is it really the body adapting correctly to stress? Irritable bowel syndrome, is it a stress adaptation or toxic environmental exposure? Fibromyalgia. What does fibromyalgia weigh? What color is it? What shape is it? Or is it really the body adapting to stress? High cholesterol. Is that really a problem, or is the body adapting to stress? Breast cancer, knowing that 85% of all breast cancers are on the left, where lymph drainage for the gut, and 15% are on the right, where lymph drainage for the lung and dental area is. Is there a reason for that, or is it bad luck? ADD, ADHD. Is it really a stress adaptation? What's causing it? What's the defect? Difficult menstrual cycles, stress adaptation, or unstable pelvis, multiple sclerosis. Is it toxic environmental exposure or stress adaptation? Remember, we're not just labeling people. Low back pain and neck pain, is it lack of medications, or is it really the body giving you an alarm telling you that there's something wrong? So, and I love this, Dr. Batman Gunji. Water cures, drugs kill. Now, medical doctors and all other doctors hold to this outdated, ignorant paradigm of disease coming from germs, bad luck, or bad genes will be stunned to realize what's ahead when they all of a sudden they will feel naked. They will see the many years of learning and memorizing scientific jargons, all the statistical analysis for the justifications of treatment protocols using toxic chemicals or invasive procedures, and the price structure attached to these acquired skills is declared obsolete. Absolutely. This is the new paradigm. If you, and health, get this, is the natural state of the human body. And the power that made the body literally heals the body. You are literally more energy than matter. Now, health is a result of action, not luck. Sickness and disease come from deficiency or toxicity and do not happen by random chance or bad luck. And your level of health is your genetic expression of your nerve supply and your lifestyle choices. Now, fundamental scientific truths. All living things, including humans, are composed of individual living cells working harmoniously together to create a self-healing and self-regulating ecosystem to maintain health and life. Health, by definition, is a state of consistent homeostatic or balanced cell function. Sickness is a lack of health, just like darkness is a lack of light. And that's what one of my masters would always say. Does darkness exist? And I'd say, yeah, up there in the corner, it's dark. And he'd say, no, that's just a lack of light. You can't measure darkness, but you can measure the photons of energy. 4, the function of our cells determine the state of our health and sickness. Absolutely. The cause of nearly all improper cell function is environmental stressors. And all environmental stressors can be divided up into one of 2 categories: deficiencies in the required ingredients for proper cell function and toxicities that poison the cell. Deficiencies and toxicities. Now, chiropractic philosophy is always that the body heals above, down, inside out. And what does that mean? That means your brain, that central nervous system, interprets signals from the environment and sends that innate, inborn intelligence flows down through the central nervous system to heal the body from the inside out. Now, that's why intention is everything. Here's a perfect example. Hypertension, high blood pressure, type 2 diabetes. Now, what does high blood pressure weigh outside of the body? What color is type 2 diabetes? And you can see, obviously, there's physical stressors. And getting the physical stress corrected, having the person take the blood pressure correctly, it was literally eliminated in 90 days. And that's because we all have this automatic nervous system. And this is in 2 parts. One part is sympathetic, and that keeps you alive under stress. The other part is parasympathetic, and that's for rest, digest, and repair. Or think every human being has 2 switches. You can be in stress or regeneration. And when you look at people who are 60, 70, 80, 90, healthy body, healthy brains, and the another group, 60, 70, 80, 90, unhealthy body, unhealthy brains, the only difference is one is regenerating, one is not. So what's the cause of this? You have to understand the adaptive stress response. And this is huge. Now, remember, stress involves every system of the body. And this could be your perceived stress or real stress. You're looking at cardiovascular function, skeletal function, digestive, nervous system, pulmonary. Every system is going to respond to stress. That fight or flight response, that primal response, when you're running away from a tiger, okay, instant. And this could be driving on the road and somebody cut you off. It could be, exposed to news things on our internet devices. And what does this do? First, that perception of stress, the amygdala, and this is the emotional processing area of the brain, interprets images and sounds, perceives danger, and sends a signal, distress signal, directly to the hypothalamus. Now, the hypothalamus, this activates the stress system. It increases heart rate, causes the liver to break down glycogen down to glucose, so you get more energy. It shuts blood supply down to the gut, elevates blood pressure, so you can have energy to get away from danger. It opens up the blood vessels of the lungs, and this is all in an instant response to keep you alive. Now, cortisol is going to be excreted by the adrenal glands, and this is a brilliant short-term response. It mobilizes and increases amino acids, the building products of proteins in the blood and liver, stimulates the liver to convert the amino acids to glucose, the primary fuel for energy, stimulates the glycogen in the liver, which is the stored form of glucose, and then mobilizes and increases fatty acids from the fat cells, also to be used as energy. I mean, cortisol is amazing. Now, cortisol also counteracts inflammation and allergies. And inflammation is a repair process. So your body doesn't want to repair it. It wants to get away from danger. Prevents loss of sodium in the urine, helps maintain blood volume and blood pressure, maintains resistance to stress. And this is infections, physical trauma, temperature extremes, maintains mood and emotional stability, short-term cortisol. Amazing. It affects the pancreas, the muscles, the liver, the bone, all the cells. Now, cortisol will increase the blood sugar. It increases energy. It suppresses the immune system because the immune system is metabolically expensive. It heightens long-term memory and attention, keep you aware of what's going on around you, increases blood pressure, decreases sensitivity to pain, and decreases serotonin level. Now, chronic cortisol is dangerous. This is not a cortisol problem. This is an intelligent adaptive response from chronic stress. Now, chronic cortisol elevations diminishes cellular utilization of glucose, increased blood sugar levels, decreases protein synthesis. Your system starts to break down, can lead to muscle wasting, osteoporosis, interferes with skin regeneration, causes shrink in the lymph tissue, and that's the sewer system of the body, diminishes lymphocyte functions, and keeps the HPA, that's hypothalamus pituitary adrenal axis, activated. Now, epinephrine surges and can damage blood vessels and arteries, increase blood pressure, raising the risk of heart attacks and strokes. Elevated cortisol can help to replenish the body's energy stores that are depleted during stress response. They also can contribute to buildup of fat tissue and weight gain, and this is fat specifically in the belly, seat, and thigh weight distribution. And that is a visual sign of chronic states of stress. Short-term effects of chronic stress, you're looking at hormonal imbalances, adrenal insufficiency, overstimulation of the thyroid, and that leads to depletion. Thyroids can also be disrupted by excessive estrogens, and a lot of pesticides are estrogen-based. Overproduction of cortisol can increase calcium mobilization from the bones to alkalinize that blood, leading to osteoporosis. So your adaptation to chronic stress, in a state of hyperstimulation, we call it a sympathetic dominant state, or that fight or flight state. Now, this means the digestive, reproductive, endocrine system, all the organs begin to break down because of the lack of nutrients and blood flow. The adrenals become exhausted, and then cortisol levels finally drop. The adrenals are usually the first order of the endocrine function to break down, followed by insulin-producing portions of the pancreas, thyroid, ovaries, parathyroid gland, pineal gland, pituitary gland, and the final link to the autonomic nervous system is the hypothalamus. So stress in the adrenals, adrenal fatigue, and understand that When you're diagnosed with adrenal fatigue, the adrenals are responding correctly based on the stimulus, correctly, not incorrectly. So when you're in a chronic state of stress, those adrenals are working as much as they can. And what are the effects of it? You're looking at low body temperature, depression, memory loss, weakened immune system, inflammatory conditions, chronic fatigue, cognitive impairment, confusion, autoimmune diseases, insomnia. Now, and again, you've got the fight or flight nervous system, sympathetic, and the parasympathetic. They got to be imbalanced. Adrenals and thyroid are the same. When the adrenals are firing, you're looking at an exhausted, low functioning thyroid, depression, heart disease, fibromyalgia, menopause symptoms, irritable bowel syndrome, irregular menstrual cycles, infertility, memory problems, weight gain, hair loss. Now, stress on the thyroid. 20 million Americans have a hypothyroidism. Now, 10 to 40% have suboptimal thyroid. Thyroid is at the mercy of cortisol. See, when they're measuring thyroid, they're only measuring TSH produced by the pituitary and T3, T4. Then T4 is broken down to T3 by the liver. And if you have high TSH and low T3, T4, they say, well, the pituitary is screaming at the thyroid and it's not working. If you see high T3, T4 and low TSH, they say the thyroid's overactive. And that's not true. It's literally the body doing everything it can now to adapt to the stress. Stress in the pancreas, diabetes, heart disease, stroke, glaucoma, itchy skin, neuropathy, kidney disease, high blood pressure, foot ulcers, hearing loss, Alzheimer's, more infections. Now, chronic stress on the digestive systems. When you're under stress, and there's physical, chemical, and emotional stress, you have 4 times less blood supply to the digestive tract. The digestive tract is called the gut brain or the enteric brain. It's where 90% of your immune system is. So it decreases metabolism, decreases enzymatic output in your gut, decreases nutrient absorption, decreases oxygenation to your gut, elevates cortisol, elevates triglycerides, decreases gut flora populations, and increases food sensitivity. Now, stress in the heart. You're looking at 1 in 3 deaths in the U.S. are attributed to heart disease. The most common is coronary artery disease. Chronic epinephrine surges can damage blood vessels and damage the arteries. And this increases blood pressure to adapt to that damage and raises the risk of heart attack. So the blood pressure is really the body adapting. According to the American Society for Microbiology, during moments of high stress, your body releases hormones such as norepinephrine, which the researchers claim can cause the dispersal of bacterial biofilms from the walls of your arteries. This dispersal can allow plaque deposits to suddenly break loose, thereby triggering a heart attack. Now, this is a recipe for disaster. When you're looking at chronic, physical, chemical, or emotional stresses, what do you end up with? Adrenal fatigue. Wait, so is adrenal fatigue really a problem or the body adapting to the stresses? Thyroid hyperstimulation. So thyroid is really the body adapting? Pancreatic overload, hormonal imbalances, nutrient deficient diet, sedentary lifestyle, toxic environment, toxic processed foods, more chemical stressors, antibiotics, destroying the gut flora, medications, altering mitochondrial function. Now, the allopathic questions, the ones that have got us so sick, how can I feel better? So not why do I have the symptom? What do I got? Give me that label. How do I treat it? Okay, what drug or therapy do I take? These type of questions have gotten us the sickest industrialized nation in the world. Now, pharmaceutical products, and this is according to the Metabolism Clinical and Experimental Journal, 2008. Pharmaceuticals, and this is virtually every drug out there, nonsteroidal anti-inflammatories, proton pump inhibitors, blood pressure drugs, everything, are linked to heart disease, cancer, nerve and mental disorders, obesity, diabetes, leukemia, bipolar disorder, schizophrenia, infertility, sexual function. And I love this quote from their article. Consequences for modern medicine are profound, since it would imply that our current understanding of pharmacology is an oversimplification. Absolutely. Absolutely. You cannot, whatever ill you got, taking a drug for that ill doesn't address the underlying cause. Wellness questions that are going to keep you alive, and these are intelligent, and the quality of your life depends on the quality of questions you ask. What am I toxic with? What am I deficient in? Why do I have these symptoms? Why? That's the key. Now, first you got to identify, reduce and eliminate and deal with, address correctly with the three stressors: physical stress, chemical stress, and emotional stress. You can boil everything down to those three. Now, number one, and this is, we can't talk about it still, censored vaccines, medication, and find out why you're taking it, environmental toxins, non-organic or genetically modified organisms for food, nutritional deficiencies, and chronic stress. For step one. And we have the 5 keys to health. Go through them. You need proper nerve supply. You have that autonomic nervous system, stress or regeneration. You need movement. You have a hunter-gatherer body. You got to move your body every day. You need proper nutrition. And this means your diet is going to be like your great-great-great-great-grandparents. Sufficient rest. This is when your body regenerates. And prayer and meditation. That stimulates the parasympathetic nervous system, and plus your body is more energy than matter. I love this quote from one of the chiropractic founders, B.J. Palmer. Muddy is medicine. I almost said money. Medicine, which is the same thing, is the study of disease and what causes man to die. Chiropractic is the study of health and what causes man to live. Absolutely. One of my instructors said, would you go to a financial analyst that only studied poverty? Would you go to a medical doctor that only studied disease and not health restoration? Adaptive physiology. This is our new site. It's the study of health and what causes man to live. Why do you have those symptoms? Those are going to be answered here. Now, on my site, we have the most advanced and effective techniques to correct structural and neurologic problems of the spine. We have classes to teach doctors how to do their job better, and even how to teach lay people on how to take care of themselves. You learn how to balance the nervous system and promote healing and normal function. There are treatment protocols for disease, conditions, or illnesses that you might encounter. The knowledge, skills, and tools to become the master of the art, science, and philosophy of chiropractic. Now, we have articles, videos, books, apprenticeship programs, consultations, in-person training, video course training. Here's an example, okay? Chris, 48-year-old woman, in pain for 7 years, hip pain, bladder problems, pain when sitting, sexual dysfunction. And she'd been to chiropractors before, and it didn't help. Literally the first visit, the pain decreased 70%. You can see her x-rays there in the past. You're looking at a leaky gut, lateral deviations. Within 3 weeks, the pain was gone because we're not giving medications to cover it up. We're identifying the physical, chemical, and emotional stressors that are the contributing factors. Now, we have online courses to teach adjusting techniques, anatomy and physiology, which the more you know how your body works, the better. Disease reversal, okay, case studies, employee training. And so you're going to know how to address these issues, even difficult cases. Here's a guy with horrible trauma, 67-year-old male, fell from a truck, quadriplegic 14 months earlier. Now, within a month, okay, he can move his right arm and both legs. And you can't adjust on the surgery site, but you can change that information coming in from the brain to the body and the body to the brain. And you give symmetrical movement because there may not be conscious control of this, but by moving the joints, you get more stimulus to the brain. We can teach all of that. We also have business management courses, case management courses, employee training, which is vital. We train every day in my offices. And technique training. You're going to love that. Technique for everybody. So you can create a free account today Go to adaptivephysiology.com and create a free account and get exclusive access to our articles and videos. Now, and I love this quote from Thomas Edison. The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. This is the new paradigm. This is where we're going to. From Astrid Aluda, the body is a temple, but only if you treat it as one. You're made, and a lot of books say you're made in the image and likeness of God. How is that? How cool is that? And literally, the world was built for you, and you were built for the world. Learn how your system works. This is stuff that should be taught in schools, but isn't. This is how your system works and how your system adapts. Get onto our site, and I look forward to seeing you on the webinars. God bless you all. Stay healthy, my friends.